Okay, so the next topic for us, actually, we're continuing the same topic. We're going to be continuing talking about changes in appetite, food intake, and GI function. And mostly this is going to be more changes in GI function. So we were talking about the stomach, so now we're moving on to the small intestine. And we have the same theme. So progesterone lowers the smooth muscle tone within the small intestine, right? And so this slide and the next slide is sort of the same theme. So this is the movement of food from the stomach through the small intestine. And keep in mind that the first portion, the small intestine, the duodenum, is where we absorb all of our, break down and absorb all our fat. It's where all iron absorption occurs, or at least the predominant amount of iron absorption, the predominant amount of calcium absorption. So a lot is going on in the duodenum. And then you have the middle large portion of the small intestine called the jejunum, and then the terminal portion called the ileum. Right? And it's in the ileum where vitamin B12 is absorbed. Right? So movement through the small intestine, all the way through the small intestine, gets slower during pregnancy because of that effect of progesterone. So there is a decrease in motility through the small intestine and an increase in transit time, meaning it's taking a longer time, more time, to get through that small intestine. Right? Now, the motility through the small intestine in non-pregnancy is not very high, right? And so movement through the small intestine is normally not very high, but it's even slower during pregnancy, and that's a benefit because since the small intestine is where we are digesting and absorbing all of our food, if it takes longer to move through, then we have greater opportunity for absorption. Okay. So we also see adaptations in the villi along the lining of the small intestine. So the individual villi along the small intestine actually get larger. They get taller. So you see hypertrophy and an increased height of these villi. Now, anything that increases the height of the villi are going to increase the surface area available for absorption. So you get a significant increase in absorptive capacity. Okay. Now, so in addition to an increase in surface area, we also see an effect on progesterone in terms of the transport mechanisms for certain substances across the small intestine wall, so across these mucosal cells. We get an increase in the transport capacity of substances like calcium, lysine, valine, glycine, praline, glucose, sodium, chloride, and water. Now, let me just mention this about those amino acids I just mentioned, lysine, valine, glycine, and praline. Now, these amino acids are amino acids that are very easily converted to glucose, either in the maternal liver or in baby. Right? And the baby, as we're going to talk about a little later when we talk about metabolism, baby is going to siphon off a lot of mom's amino acids, especially those that are easily convertible to glucose. Okay? So we're enhancing mom's absorption of these amino acids so that we make them available for baby. The progesterone also increases the activity of lactase and maltase. Those are the enzymes that break down lactose and maltose, okay, which just is going to increase the absorption of glucose and other monosaccharides like galactose and fructose. Additionally, the duodenal absorption of iron increases by nearly twofold by late pregnancy. So mom is absorbing almost at least twice as much iron as she was before she was pregnant. Right? And we talked about how the iron requirements for baby are a must. So if a baby doesn't get the iron it needs, it's going to take it from mom, even take it directly from her bloodstream. So this is a very beneficial adaptation. Now, moving from the small intestine into the large intestine. So once, here's that terminal ileum moving into the cecum, which is the first portion of the large intestine. Now, once we get to the large intestine, we don't have any more absorption of food, but we do have absorption of sodium, of water, electrolytes, and minerals. So in the colon, in the large intestine, what we see again is that progesterone lowers the smooth muscle tone so that the motility and movement through the large intestine is slowed. This increases the absorption of water, electrolytes like sodium, iron, and calcium. Okay, so we doubled our iron absorption in the small intestine, and we're going to further increase our iron absorption in the colon. Now, because we have a greater absorption of water in the colon, the fecal matter, by the time it reaches the rectum, has less water content. So women during pregnancy have a pretty significant increased risk of constipation. So consuming enough water is going to be very important. Consuming foods that have a high fiber content is also going to be very important in order to loosen that stool and avoid constipation. There's another part of the story too with the increased risk of constipation for women during pregnancy, is that women often experience some degree of constipation during pregnancy. Women who are taking iron supplements, right? And iron is actually found in all the prenatal vitamin preparations that you can commercially buy. But then on top of that, a lot of women are also taking additional iron supplements if they are deemed vulnerable. So iron also tends to cause constipation. It also tends to cause more water absorption by the colon. So a woman who's pregnant, already at risk for constipation because of this decreased motility through the colon. Additionally, she's doing what she should be doing, taking her prenatal vitamins and her supplements of iron, which is going to further increase her risk of constipation. Okay? Now, when anybody has constipation periodically or chronically, what that does is it increases the risk for a condition called hemorrhoids. And hemorrhoids, you can see here's the rectum and the anal wall, and there are these veins that line the rectum and the internal anal sphincter. Okay? Now, these veins, in the case of hemorrhoids, become tortuous and distended. Okay? They become varicose veins. And sometimes those veins get so tortuous and varicose that they start to bleed and they cause pain. So you can have varicose hemorrhoids or you can have hemorrhoids that are within the rectal wall, and they'll cause bleeding, and that's more likely to be sort of painless bleeding. But then you can also have hemorrhoids at the internal anal wall, and sometimes those hemorrhoids are going to protrude out of the anus. It's going to be painful. They can also bleed, and they can also become incarcerated, right? Where the hemorrhoid gets trapped outside, you get a blood clot in that entrapped hemorrhoid, and that is extremely painful, and it actually needs to be surgically removed. So hemorrhoids are a potential complication of pregnancy. It tends to be connected to constipation, and it also there's an increased risk of it just simply because of the uterus, right? The enlarging baby and the uterine mass sort of pushing against the vena cava and all the blood vessels that are draining the veins within the rectal wall. Okay? So the increased risk of constipation is made even more likely with this additional intake of iron. And then if this occurs, this increased constipation, it increases the risk of hemorrhoids, which was already increased during pregnancy. Okay, so we also see changes in the liver and the gallbladder. So first off, again, progesterone is going to affect the smooth muscle tone of both the gallbladder and the bile duct. Now, progesterone reduces the smooth muscle tone, and that tends to increase the volume of bile storage and decrease the emptying rate of the gallbladder. Now, this tendency for, or increased tendency for bile retention can cause, increase the risk of gallstone formation. Okay? And also, it can, especially in late pregnancy, can manifest as sort of itchy, irritable skin as these bile salts gets absorbed in the bloodstream and start depositing themselves in the skin. Right? So women in late pregnancy sometimes complain of this itchy, irritable skin, and it's because of this retention of bile salts and the absorption of those bile salts. Now, pregnancy induces an enlargement of the liver, mostly because of, it's not a pathological enlargement, it's just an increase in blood flow of the liver. Okay, the liver is another one of our metabolic organs, and as our as mom and baby's metabolism goes up, the need to metabolize waste goes up. So liver blood flow increases and the liver enlarges. The liver also starts to increase its storage of glycogen and triglycerides, okay, in order to increase that potential for that glucose reservoir for the bloodstream. And the first trimester elevation of estrogen and progesterone also affects the liver's synthesis of things like plasma proteins, enzymes, and lipids. So we talked about how there's an increase in absolute albumin during pregnancy, an increase in fibrinogen during pregnancy, and an increase in cholesterol. So those are all synthesized by the liver, and it's done in response to this rise in estrogen and progesterone during pregnancy that starts very early in pregnancy.